Hello guys, how are you? Good morning. Today I am going to learn physical diagnosis of CNS. So let us go. Where is it? Okay, got it. So we'll start with tables. Table 4 abnormal posture in comatose patients. Decorticate rigidity, abnormal flexure or response. In decorticated rigidity, the upper arms are flexed right to the side and with elbows raised and fingers flexed. The left, the feet are plantar flexed. This posture implies additionally near the okay, ठीक है, okay. Hmm. Okay. Okay, so we have got three types of sitting position in case of decorticate, hemiplegia, and deliberate postures in comatose patients. Let's highlight this. ठीक है। पहले फ्लासिड, उसके बाद स्पास्टिक। फ्लासिड प्लास्टिक। फ्लासिड स्पास्टिक। ओके। Stability. Extension of arm, forearm, plantar flexion, and pronation of the wrist. Okay. Adduction of the arm. Okay, and this happens in the when there is lesion in the diencephalon, and yeah, and in the case of hypoxia or hypoglycemia, it can also occur. Okay. Okay. Pupil in comatose patients. Patient pupillary size equally and light reactions are important signs in assessing the cause of coma. The region of the brain that is impaired. Keep in mind that that unrelated pupillary abnormalities may proceed to coma. For example, the for very small pupils. Mhm. Gee. Structural damage to in the midbrain. Sympathomimetics. What is the effect of sympathetic and parasympathetic nervous system on dilation is caused by sympathy and constriction is caused by parasympathetic. Okay, so in the case of constriction, it is due to the lack of sympathy or excess of parasympathy. है ना? And in the case of direction, it is more of a sympathy and less of parasympathy. Okay, ठीक है, simple है. Hmm. Okay. Herniation, it is the most common cause of a one large pupil, okay, and damage and compression of the oculomotor nerve and midbrain. A single large pupil is commonly seen in diabetic patients with infarction of a cranial nerve number 3. Okay. Glasgow School. Yeah. So eye opening. Okay. So none. Okay. So okay. So eye opening, none even to supraorbital pressure, to pain from sternum or limb or supraorbital pressure. Okay. Now three non-specific response not necessary to command, and fourth eye opens not necessarily aware. Okay. Motor responses, none. One to any pain, limbs remain flaccid. Extension. Second, to shoulder adductor and shoulder and forearm internal rigidity. Three, withdrawal response or assumption of hemiplegic posture. Fourth, arm withdrawals to pain, shoulder abducts, and localizes pain. If arm attempt to remove supraorbital pressure and obvious command 6.3. Orbital response, none, no violation of any type, incompressible, more grown, no speech, okay, inappropriate, intelligible, no suspicious, mhm, okay, T, hmm. Metabolic and structural coma. Okay. So although these are many cause of coma, most can be classified as either structural or metabolic. Findings may vary widely in individual patients. The features listed are general guidelines rather than strict diagnostic psychiatry. Okay. G. Pathophysiology. Toxic, metabolic, structural. Okay. Arousal centers, poison or critical substrate depleted. Okay. Inhibition. ठीक है. Okay. So toxic में क्या होता है कि toxic में chemicals. These are chemicals which alter the chemistry of the brain. Okay. And in structural, what I mean that in structural, the brain part is compressed, or there is hemorrhage or there is a stroke. Yeah. Yeah. Okay. Okay. Or maybe tumor. Yeah. Hmm. Maybe normal or hyperventilation if okay. Giant strokes. Giant strokes breathing. Yes. Okay. Or ataxic breathing. Okay. Okay. Also with this dividing the apnea respiration begin. Okay. So there is a giant strokes or ataxic breathing in case of in case of a structural damage to the brain, and in the case of toxic or metabolic, there could be giant strokes, but mainly it is normal or hyperventilation. Okay. Okay. And also in the case of structural damage to the brain, we can see the apneustic respiration. Apneustic. Peak inspiratory arrest or central hyperventilation. T. People is yeah. In the case of toxic or metabolic disorders of the which causes coma, the people they react normally. Like when we flash light on the patient's people, it gets constricted. Like equal. Okay. If you hmm, you mean okay, magnifying glass. Yeah. Hmm. Hmm. Okay. Okay. Uh, then directed fixed suggest compression of. Huh. Gee. Uremia, hypoglycemic shock, alcohol, drugs, liver failure, hypothyroidism, hypoglycemia, anoxia, ischemia, meningitis, encephalitis, hypothermia. T. And in the case of structural or the damage to the brain, epidural, subdural, or intracerebral hemorrhage, large cerebral infarction, tumor, abscess, brainstem infarct, tumor or hemorrhage, cerebral infarct, hemorrhage, tumor. T. You get the point, right? T. Hmm. Yeah. So I'm going to get this plastic hemiparesis. What is hemiparesis? T. Seen in quarter tract lesions that cause poor control of flexor muscles during swing phase. Mm, T. Affected arm is flexed, immobile, and held close to side with elbows. Caesar's gate. Seen in spinal cord damage causing bilateral lower extremity spasticity, including adductor spasm. Receive patient advance each leg slowly and the thigh extend to restore from in. Mhm. Okay. T. Savage gait. Seen in foot drop, usually secondary to peripheral motor unit diseases. Patients either drag the feet or lift them high with knees flexed and bring them down with slap. Hmm. Tibial anterior and toe flexors are weak. Parkinsonism gait. Seen in basal ganglia defects of Parkinson, stooped with flexion of head, arms, hips, and knees. Patients are slow getting started. So short and shuffling within involuntary hastening fascination. Arm swings are decreased and patient turn around stiffly all in one piece. T. Hmm. Cerebral ataxia is staggering and unsteady with feet wide apart and exaggerated difficulty on turns. Mhm. Hmm. Whether the eyes closed or not, this is the feature of the cerebral ataxia. Patients cannot stand steadily with feet together, whether eyes are closed. Dysmetria, nystagmus, and intentional tremor. T. T. Sensory ataxia. Seen in loss of sensory ataxia is seen in loss position sense in the legs from polyneuropathy or posterior column damage. Gait is unsteady and wide based. Patients throw their feet forward and outward and bring them down positionally and then although with the down. Mhm. Okay. The Romberg sign is positive in case of a sensory attacks. The Romberg sign is basically when we ask the patient to do like this and close his eyes and we watch if he tangles or if he falls down. Uh, T. Hmm. Disorders of muscle tone, flaccidity, spasticity, rigidity, paratonia. The fuck? Okay, so the spasticity is caused when there is a upper motor neuron और corticospinal tract lesion. Okay, ठीक है. Okay. So, spasticity is caused when there is a lesion in upper motor neuron tracts or corticospinal tract. Okay. In case of flaccidity, we see lower motor neuron lesion. In the case of rigidity, we see basal ganglia system is impaired, and in the case of paratonia, all both hemispheres usually in the frontal lobes. Okay. 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 Description: increased muscle tone, hypotonia is rate dependent. Tone increases when passive movement is rapid and decreases when passive movement is slow. Tone is also greater at extremities of movement arc. During rapid passive movement, initial hypotonia may give way suddenly as the limb relaxes. This plastic catch and okay. दोबारा increase muscle tone hypotonia is rate dependent. Tone increases when passive movement is rapid and decreases when the passive movement is slow. Okay. Tone is also greater at the extremities of the movement arc. During rapid and passive movement, initial hypotonia may give way suddenly as the limb relaxes. Hmm? ये क्या है यार समझा नहीं. We'll see what this is. Hmm. Okay. Hmm. Mm-hmm. Mm. Gee. Class knife resistance. In this in this spasticity or upper motor neuron lesion. Rigidity in case of Parkinsonism. Um, okay. Flaccid or hypotonia. Loss of muscle tone. Hypotonia causes the limb to be loose or floppy. The affected limbs may be hyper extensible or even flat like flaccid muscles are often weak. Guillain-Barré syndrome. Yes. Hmm. Dementia. Gee. Hmm. That's a facial paralysis. Facial weakness or paralysis may result from either a peripheral lesion of nerve number 7, facial nerve, anywhere from its origin in the pons to its periphery, a central lesion involving the upper motor neuron between the cortex and the pons, the peripheral lesion of cranial cell by Bell's palsy. Okay. Is compared with centrally with left hemisphere cerebral ischemia infarction. Sorry, left hemispheric cerebral infarction. Okay. Yeah. Hmm. The lower portion of the face is normally controlled by the upper motor neuron located on only one side of the cortex. Yes. The lower portion, okay. The opposite side, the left hemispheric damage to लेफ्ट राइट हो तो पता है ना मतलब जी अपना ये वाला भाग जो है वो ये वाला भाग का रन करता है, मतलब उसको कंट्रोल करता है ना। और और जो राइट वाला भाग जो है अपना फेस का, वो लेफ्ट लेफ्ट वाला ब्रेन कर करता है। और जो लेफ्ट वाला लेफ्ट लेफ्ट पार्ट ऑफ फेस है, दैट इज गवर्न बाय द राइट पार्ट ऑफ द ब्रेन। ठीक। So if there is lesion in the left hemisphere of the brain by the stroke or paralysis, it will affect the right side of the face. Yeah. Hmm. Okay. Peripheral nerve damage to cranial nerves paralyzes the entire right side of the face during the fall. Huh. Flat nasal level fold is seen in both types of infarction. Sorry, in both cases of lesion of the seventh cranial nerve, that is facial nerve. So, okay. In the case of peripheral damage to the facial nerve, that is the Bell's palsy, and second is like in the case of a cerebral infarction. Yeah. Flat nasal level fold is seen in both types of lesions. Hmm. Nystagmus. Horizontal nystagmus. The movement of nystagmus may occur in one or more planes, namely horizontal, vertical, or rotary. It is a plane of movement, not. Okay. Okay. Oh, अच्छा. Nystagmus is a rhythmic oscillation of the eyes, analogous to a tremor in other parts of the body. It has multiple causes, including impairment of vision in early life, disorders of labyrinth and cerebral system, and drug toxicity. Nystagmus occurs normally when a person watches a rapidly moving object. Okay. Nystagmus. It's a rhythmic oscillation of the eyes and a temple in other words. Labyrinth and celebration. Okay. Okay. Hmm. Although nystagmus may be present in all directions of gaze, it may appear or become essential only on deviation of the eyes. Okay, so disorders of speech. Disorders of speech fall into three groups affecting the phonation of voice, articulation of words, and production and comprehension of language. Aphasia refers to loss of voice that accompanies diseases affecting the larynx or its nerve supply. Dysphonia refers to less severe impairment in the volume, quality, or pitch of voice. For example, a person may be hoarse or only able to speak in a whisper, causing to laryngitis, laryngeal tumor, and unilateral vocal cord paralysis, cranial nerve number 10. Dysarthria refers to defect in muscular control of speech, lips, tongue, palate, or pharynx. Words nasal, slurred, or indistinct, but the central symbolic aspect of the language remains intact. Causes include motor lesions of the CNS, penis, Parkinson's, and cerebral disease. Aphasia. Oh, aphonia is different. Gee. Aphasia refers to disorder in producing or understanding language. Gee. Oh. Wernicke's fluent receptive aphasia. Aphasia is a disorder in producing words, in producing language, in producing or understanding language. ठीक है. It is often caused by lesions in the dominant cerebral hemisphere, usually the left. Compared below are two common types of aphasia: Wernicke's fluent receptive aphasia and Broca non-fluent or expressive aphasia. There are other less commonly kinds of aphasia. Mm, T. Wernicke's and Broca's aphasia. Aphasia means difficulty in understanding or producing language. Difficulty in understanding or producing language is called as aphasia. Often it's basically loss of voice due to uh, 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 no, so and yeah, and this one is referred to less volume means there is impairment in the volume of the volume, pitch, and the sound of the voice, and disorder refers to defect in muscular. There is some defect in the muscular control of the voice, like in pharynx, larynx, esophagus. um, is, T- T- hmm, T. Tremors and involuntary movements. Tremors are rhythmic oscillations of movements which may be roughly subdivided into three groups: resting or static tremors, postural tremors, and intention tremors. Tremors. Okay, so resting static tremor, these tremors are more at rest and may decrease or disappear with the voluntary movement illustrated as. Hmm, 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 hmm. Intention tremor absent at rest appear with movement and often get worse as the target gets closer. Multiple sclerosis is the common cause of intention tremor. Multiple sclerosis. Oral facial dyskinesis. Oral facial dyskinesis are arrhythmic, repetitive, bizarre movements that chiefly involve the face, mouth, jaw, and tongue. Grimacing, pursing, pursing of lips, protrusion of the tongue, opening and closing of mouth, and deviation of the jaw. The limbs of and trunk are inward less often. These movements may be a late complication of the cyber like phenothisis termed tardive late dyskinesis. They also occur in long-standing psychosis in some attentless patient क्या होता है? What is the meaning of a attentless persons? Will you will it? अच्छा having no teeth. Okay. हाँ हाँ हाँ. Okay. Hmm. Okay. Tics are brief, repetitive, stereotyped, coordinated movements occurring at irregular intervals. Example include repetitive winking, grimacing, and shoulder shrugging. Causes include the Tourette syndrome and the late effect of a drug like phenothiazines. Tics. Dystonia. Movements are similar to artethoid movements. What is artethoid? Artethoid movements are slower and more twisting and writhing than cuneiform movements and have a larger amplitude. The most commonly involve the face and the displacement. Okay. Korea. Korea form movements are brief, rapid, jerky, irregular, and unpredictable. They occur at rest or interrupt normal coordinated movements. Unlike tics, they seldom repeat. Okay, they don't repeat. Okay. Hmm. Syndrome Korea. Yeah. Syndrome Korea with acute rheumatic fever and Huntington's disease. Korea. Dystonia. Dystonic movements are similar to adult movements, but often involve large. Okay, so large dystonia is like a into 100. Hmm. Dystonia is a third into 100. Okay, tongue gross. Hmm. Phenothiazins are responsible for the movement disorders of the face, arms, and chorea like. No, not chorea like. Chorea is due to the Huntington's disease and the syndrome chorea from the acute rheumatic fever. Pulmonary torticollis. So, seizure disorders. Seizures were reclassified. Okay, so there are two types of seizures: focal or generalized, to better reflect current medical science. Underlying causes should be genetic, structural, or metabolic, or unknown. Yes, too cold here. Okay, so we have two types of seizures: focal and generalized seizure. Underlying causes should be identified as genetic, structural, metabolic, or unknown. The complexities of the reclassification scheme are best explored by turning to report. Okay, focal or generalized seizure. Genetic, structural, metabolic, or unknown. ठीक है. Focal seizures are conceptualized as okay. Okay. Focal seizure without impairment of consciousness with observable motor and autonomic symptoms. Jacksonian tonic, then chronic movement that start in the that start unilaterally in on one hand in the hand. Jacksonian on the same side. Okay. Subject to sensory or psychic phenomena, numbness, tingling, simple visual, auditory, or olfactory hallucinations like flashing lights, buzzing, or odors. Anxiety or fear, feeling of a familiar deja vu. Oh, acha, okay. Okay. Focal seizure with impairment of consciousness. Seizures may or may not start with autonomic or psychic symptoms outlined above. The consciousness is impaired and the person appears confused. Hmm. Okay. Focal seizure that used partial seizures that resemble chronic seizures as a tonic seizure. Generalized seizure and pseudo seizures. Generalized seizures. Wait for a second, bro. So generalized seizure and pseudo. Okay. Hmm. Hmm. Maroni. Sudden, brief, rapid jokes, involving the trunk or limbs associated with variety disorders, myoclonic attack, drop attack, severe loss of consciousness with falling but no movement. Hmm. Hmm. Syncope. Hmm. 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 Decreased venous return and an excessive fall in cardiac output or by an inadequate vasoconstrictor mechanism with inadequate release of norepinephrine. Hypovolemia or diminished blood volume and insufficient to maintain cardiac output and blood pressure. Hmm. G. What is orthostatic hypotension? Hypotension. It is basically drop in systolic blood pressure more than 20 mm of Hg and more than 10 mm Hg in diastolic BP and yeah uh, when standing for more than 3 minutes. Hmm. See. Mm-hmm. Hmm. Cardiac syncope. Neurally mediated, possibly from reflex vasodepressor, bradycardia response, cerebral hypoperfusion, increased CSF pressure also proposed. Severe paroxysm of coughing. Okay. And what are the precipitating factors? COPD, asthma, pulmonary hypertension typically occurs in overweight, middle-aged patients. Prodromal manifestations often none except for lack of blood vision, lightheadedness may occur. Posterior association commonly may occur in obesity and recovery. Hmm, okay. Nutrition is okay. So hypertension. Hmm. Okay. Mm-hmm. Hmm. Acceleration falls with exercise or but Arrhythmias का definition. Semi or disconduction ability. Most common cause of cardiac syncope is the arrhythmias. Cardiac syncope. Okay. Hmm. 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 Okay. Disorders resembling syncope, hypocapnia due to hyperventilation, constriction of cerebral blood vessels from hypocapnia induced by hyperventilation. Anxiety and panic disorders are the precipitating factors, and predisposing factors are like anxiety. Manifestation is like dyspnea, palpitation, chest discomfort, numbness, and tingling in hands and around the mouth, lasting several minutes. Consistency is often maintained. Okay. And postural manifestations are like hmm, hypoglycemia, insufficient glucose to maintain cerebral epinephrine. Mhm. Okay. And the last one is like a fainting from conversion disorders. The termed functional neurologic symptom disorder in DSM-5. The symbolic expression of an unexpected idea through behavior, skin color, vital signs may be normal symptoms with bizarre purpose movement. Oh, okay. Okay. Mm-hmm. Okay. सिंगल में होगा type of stroke. Assessment of stroke requires careful history taking and a detailed physical examination and should focus on three fundamental questions. What brain area are and related vascular territory explain the patient's findings. Is a stroke ischemic or hemorrhagic? If ischemia, is there mechanism thrombosis or embolism? Stroke is a medical emergency and timing is of essence. Answer to this question are G. In acute ischemic stroke, ischemic injury begins with a central core of very low perfusion and often irreversible cell death. This core is surrounded by an ischemia penumbra. Okay. Because most irreversible damage occurs in the first 3 to 6 months. So contralateral leg weakness, vascular treated anterior cerebral. Subcorticulate. Shell tremor. Sensational phenomenon or decreased Parkinsonism. This diadococ. This kinase and dysmetria. Sensation not affected. Okay. So anti-horn cell weakness entropy in the seminal whole plant has circulations and same. Mhm. Okay. So one is the anti-horn cell, second is the spinal nerves or and roots, third is the peripheral mononeuropathy, fourth is the peripheral polyneuropathy, fifth is like a neuromuscular junction system muscle. Finished. Yes, guys, I have completely finish the tables of this physical examination. So in the next 2 hours, I'll start the learning the chapter. So yeah, thank you for watching and bye.